Hi, my name is Jane Morton. I work for the Western Montana Area 6 Agency on Aging here in Polson. We're located at 110 Main, Suite 5, Polson, Montana 59860. Our phone number is 406-883-7284, or the toll-free number is 1-800-551-3191. I'm one of 4 SHIP counselors that are certified by the state of Montana to help you with Medicare. And our agency, we also serve 3 other counties besides Lake County, and we have certified SHIP counselors in every area that can help you. Okay. Also, we can mail you a copy of this presentation if you would like a copy of these slides. We have SHIP counselors in all of our counties, as I said. Also, if you call the Social Security Administration, they can help you with issues relating to Medicare, to signing up. First of all, what is Medicare? Medicare is a health insurance program for people who are 65 and older, mainly. It's also for people who are under 65 who have either been on Social Security disability for 24 months or have one of the listed diseases there. Do I need to read those? Mm-hmm. End-stage renal disease, which is kidney failure, ALS or Lou Gehrig's disease, asbestosis relating to the problem up in the Libby area with asbestos. And if you have those problems, you don't have to wait 24 months. You can get on sooner. Medicare has 4 parts. I always say there's a department in Washington, D.C. that makes things as complicated sounding as they can, and that's their whole job. Part A and B are what I'm going to mainly talk about in this part. The Part C, Medicare Advantage plans, we'll be talking about in the later part, and also prescription drug insurance and Medigap plans. Okay, first of all, how do you get signed up? Well, the Social Security Administration are who determines your eligibility, signs you up, and sends you your card. When can you do that? Well, for most people it's around it's the 7 months surrounding their 65th birthday month. 3 months before the birthday month, 3 months after the birthday month, and 3 months after the birthday month. If you are under 65, it's on your 25th month of disability. If you are still working and you choose not to get Part B, and we'll talk about why a little bit later, if you have employer insurance, then you have 8 months from the end of your employer insurance to sign up for Part B. Here's a graphic that shows that initial enrollment period, which is what most people use. 3 months before they turn 65, the month they turn 65, or 3 months after 65. You can see by this graphic that it's a lot better for you to sign up before your birthday month so that your coverage starts on the very first of the month that you were born. However, if you wait until your actual birthday month or the 3 months after, then the start of your coverage will be delayed. If you miss your initial enrollment period or your special enrollment period because you had employer insurance, You can still sign up for Medicare, but you have to wait for the general enrollment period, which is January, February, and March of each year. The biggest problem with that is if you sign up during the general enrollment period, your coverage doesn't start until July 1st of that year. And if you wait until July 1st, then you may end up with a late enrollment penalty. We'll talk some more about late enrollment penalties too. How do I get started Part A? As I said, most people automatically get Part A. If you're already drawing your Social Security or railroad retirement, or if you have been getting Social Security disability for 24 months, they'll mail it to you automatically. It'll come in the mail about 3 months before you become eligible for Medicare, either when you turn 65 or on that 25th month of disability. This is what your Medicare card looks like. It's not a plastic card like a credit card or a driver's license. It's similar to your Social Security card, which is just a little cardboard, lightweight cardboard card. It comes in the mail attached to a larger card, and we've had a lot of people throw their Medicare card away thinking it's junk mail. When you're turning 65, you get a lot of junk mail from different insurance companies, but watch that mail carefully because your Medicare card might be in there. How do I do that if I'm not automatically enrolled and I need to sign up? Which if you're not drawing your Social Security yet, you'll need to enroll. You can visit the Social Security office, or you can call the Social Security office, or at the bottom is the best way. You can enroll online at www.ssa.gov. That is a website that anybody can go on, so you can do it yourself, or you can call a SHIP counselor and we can help you sign up online. Most people don't have to pay a monthly premium for Part A. If you or your spouse have at least 40 quarters, which comes out to about 10 years of work history where you paid payroll taxes, then you don't have to pay for Part A because you've been paying for it all these years in your payroll taxes. For people who don't have enough work experience, neither they nor their spouse has 10 years or more of payroll tax records, then those people can sign up for Part A and pay a premium if they want to. You might have a late penalty with this. You don't have to worry about a late penalty if you have premium-free Part A. But if you have to pay a premium for Part A, you definitely want to do it in a timely manner. Sign up for it in a timely manner. Okay, I'm referring mostly to original Medicare. Do you need to turn the camera so they can see this? Part A, the premium free, is your hospital insurance, and I'll be talking about Part A and Part B in this section. Okay, Medicare Part A pays for hospital stays, skilled nursing facility care, home health, and hospice. And I'm going to talk about each of those one at a time. So first let's talk about hospital stays. That's probably the most common use for Part A. Even though there is no monthly premium to pay for Part A, there are deductibles and co-pays. First, there is a deductible of $1,408. If you get put in the hospital and you're on Medicare, you're responsible to pay the first $1,408. Now that's a per benefit period deductible. Once you get in the hospital and you stay there continuously, no matter how long you stay there, you only have to pay the deductible once. But if you're hospitalized, you get out and you're out of the hospital for 60 days or more, and then you have to be hospitalized again, that's a new benefit period. You'd have to pay that deductible over again. Okay, down on the co-payments, for days 1 through 60, once you've paid the deductible, then you don't have any copay on your hospital bill. If you're still in the hospital after 60 days, for days 61 through 90, you have a copay of $352 a day. If you're still in the hospital after 90 days, you've been there continuously, for days 91 through 150, you have to pay a copay of $704 a day. Now that one on the bottom, days 91 through 150, that's a lifetime benefit. That means they only will pay for days 91 through 150 once in your lifetime. Part A also covers skilled nursing facility care. This is not long-term care, as in grandma has to move to the nursing home. Medicare does not cover long-term care. But if you are in the hospital for a minimum 3-day stay and the doctor prescribes some rehab, then you can go to a skilled nursing facility and the first 20 days are covered in full. Now it's really important if you're hospitalized to know if you have been formally admitted to the hospital, because they can keep you overnight and still call it observation status. So it's important to know that, because if you're really sick or hurt and you're going to need some rehab, you're going to want Medicare to pay for those first 20 days. And it'll only do that if you've been admitted to the hospital for a minimum of 3 days. So if you've been admitted for a minimum of 3 days and then you're sent to rehab, Medicare will pay for up to 20 days in full. If you're still there after 20 days, for days 21 through 100, your copay is $176 a day. Once you hit 100 days, your Medicare benefit is used up. So it'll all come out of your pocket after 100 days. Also, you need to know that if the only need in the skilled nursing facility is personal care, Medicare doesn't cover that. It's if you need skilled nursing care. And then again, there's a reminder at the bottom that Medicare does not pay long-term care. Medicare Part A covers home health care. Again, it has to be ordered by your doctor, and they have to see you face-to-face to write an order for home health care. And the home health care needs to be intermittent skilled care. So one of the things listed there, home health care does not pay for somebody to come over and cook your meals or clean your house. Also at the bottom there, if you have durable medical equipment such as a hospital bed, you pay 20% of that cost, and Medicare Part A pays 80%. Medicare Part A also covers hospice. If you're unfortunate enough to be diagnosed with a terminal illness, you can go on hospice if you choose and have palliative care in your home if you are expected to live for less than 6 months. Now, if you live longer than is expected and the 6 months are up, the doctor can recertify you for another 60 days and another 60 days. So you don't have to wait until you think you're on your last gasp. If you're terminally ill and you're expected to live for less than 6 months, the doctor can certify you and then keep recertifying you if you live longer than expected. Okay, now we're going to talk about Part B. Now, Part A covers the things I mentioned. But Part B covers pretty much everything else that's medically necessary. To sign up for Part B, it's pretty much the same as Part A. You have the same enrollment periods. If you enroll online, you have a chance to decline Part B, so you can sign up for just Part A. If you are automatically enrolled, your card is going to come. Oh, I thought that was going to show a picture of your card again. If you are automatically enrolled, your card is going to come showing that you have both Part A and Part B. There's directions when that comes of how to decline Part B if you want to. Medicare Part B insurance covers, as I said, anything medically necessary that's not inpatient, basically. So doctors, outpatient care, medical equipment, labs, ambulance, anything, as I said, that's not inpatient is usually under Part B. Part B does not cover any vision or dental or hearing aids. It also does not cover routine foot care, and it doesn't cover long-term care, and it also doesn't cover things which are not medically necessary, like getting your nose fixed or a facelift or anything that's cosmetic that is not medically necessary is not covered. Medicare Care Part B does have a monthly premium for everyone. In 2020, the monthly premium is $144.60. It's higher if you have, if you're in the higher income bracket, and we have materials we can send you to show what the brackets are and what the costs would be. In 2020, there is a deductible under Part B. The deductible is $198, and it is an annual deductible, so you're responsible to pay the first $198 in the year of your Part B expenses. Then Medicare Part B covers 80%, and your co-insurance, the part you're responsible for, is 20%. If you're unable to afford that monthly premium of Part B, or if you're really low income and you're unable to afford even the 20%, there are safety net programs to help you pay for those things. They're called the Medicare Savings Programs. You apply through the Office of Public Assistance. Obviously, you have to be 65 or older or disabled because you have to be eligible for Medicare, a Montana resident, and you have a Social Security number, and meet the income and resource guidelines. Now, there are different levels of Medicare Savings Program. The most help is for those with the lowest income. It's called the Qualified Medicare Beneficiary Program, or QMB. And that will pay any premiums that you have to pay for A or B, and it will also pay all deductibles and co-insurance. The programs for a little bit higher income is Special Low Income Medicare Beneficiary or Qualified Individual, and those two programs will pay for your Part B monthly premium only. Here are the income and resource limits for the Medicare Savings Programs. These are the upper limits for the higher programs. You'd have to have lower income and resources to get the Qualified Medical Beneficiary. For single, the income limit is $1,436 a month. The resource limit is you must have less than $7,860. And for couples, the income limit is $1,940 a month, and the resource limit is $11,800. Those are, again, the 2020 numbers. Part B also covers a number of preventative benefits. It covers them at 100%. Screenings such as mammograms or colonoscopy or flu shots or pneumonia shots. You do have to be careful with they don't really cover physicals. They cover wellness visits where you go in and talk to the doctor and discuss things, and they take your temperature and your blood pressure and all of that, but it's not a full physical like a full blood panel or x-rays, or if you have any of those things done, you pay for 20% of those. Okay, that's the end of our part 1. Welcome to Medicare series. Again, we are the Western Montana Area 6 Agency on Aging. We serve Lake, Lincoln, Mineral, and Sanders counties. Our address is 110 Main Suite 5, Polson, Montana. And our phone number is 406-883-7284 or 1-800-551-3191.